Hi, good morning. This is me, Jasmine. I hope you're doing well. Well, I just got ready to go for my duty, but I have still some time left with me. So I thought to do something about the speaking criteria which I was told you in the last video. Okay. So what is this speaking criteria? I'm not going to talk about the evaluation criteria. This is something, a top tip, which would be helpful for getting 400 plus in your speaking module. Okay, I made it in a short way so that you can learn it very quickly. I can SERIC. What is this I can SERIC? I'll explain you. This is in a short way I told you, so it would be helpful for you to learn very quickly. What is this I can SERIC? This I stands for information collection, which is very necessary in our speaking role play. What is this information collection? When a patient comes to the hospital clinic, you need to ask about the reason why he or she visit there. And we will ask about the history, what happened with them. Okay, this is called information collection. We are collecting information from the patient. Okay, this is the first step we need to do in the role play card. Clear? Okay, then next is C. I can, in that it is C, right? What is C? C is a concern. Well, during the role play, we need to ask about the concern, right? So we have some phrases. We need to be familiar with these phrases. It would be very helpful in your speaking, okay? So concern, how you are going to ask about the concern? Maria, do you have any other concern? In other way, you can ask, is there anything else I should answer for you? So this is called concerns. Next is A. What is A? A is acknowledgement. How can you acknowledge things in role play card? See, when a patient says some situation or something, you can say that I completely understand your concern, Maria. I completely understand your situation. I definitely understand your situation. This is something called an acknowledgement. And what next? It is N. N for normalization. Okay? When a patient says something like maybe some situation or something like that, okay, you need to normalize the things. How you can normalize? You can say if a patient come with a daughter and she is so much worried about, and maybe she have some fracture or something, the daughter have fracture or something, so you can say, well, Maria, this is quite normal in this age group, nothing to be worried at all, okay? And in other way you can say, this is quite normal to feel this way. This is called a normalization. Clear? And what is next? It is S. S stands for sign and structure. How you do a sign and structure in a role play card? So mostly the sign and structure we are doing in the recommendation time. While when we need to say something, I mean some suggestion or something, we can do this sign and structure over there. For example, you need to tell something after discharge, the patient need to follow these things. Then how you can say that? Firstly, you need to continue your medication, and secondly, you need to continue the physiotherapy regularly, and finally, you need to take adequate rest. Okay, I hope you understood. This empathy is must in your speaking. You know that a nurse should have this quality. She should show empathy to the patient, right? So empathy is must in the speaking. Well, how you can do this empathy? When a patient says something, some concern, whenever she says something about her worries, you can empathize that. How you can do that? You can reply that, oh Maria, I'm so sorry to hear that. Oh Maria, I know how hurtful this situation is. Oh Maria, I know how stressful the situation is, but nothing to be worried at all, because you are in the right place and we have expertise doctors and nurses over here. We will provide your son proper care and treatment from here. Okay, like that you can do empathy. With empathy you need to do some reassurance too. Next is R. R stands for restating. You need to do this restating whenever patient says some history or some habits. You can do this restating there. Okay, for example, if a patient says some symptoms, nurse, I have Nurse, since yesterday I had feeling nausea, vomiting and diarrhea. So you can restart like this. Okay, if I heard you right, you have conveyed that you have been experiencing nausea, vomiting, and diarrhea, isn't it? Okay, thank you for sharing this information with me. It's helped me to understand your condition much better. You can reply like that. After restating, you can say it like this way. The next is I for information gathering. Information gathering, something like we are giving advices and recommendation and we are collecting information. This is called information gathering. In the first I told information collection. This is also same like that. Not only we are collecting information, we are giving something like maybe advice and recommendations. Okay. Alright, and the last one is greetings. Greeting is a must things we need to do in the role play card, because many students they will forget about the greetings and they will not think this is necessary, but it is necessary and you'll get marked for that. How you will do this greeting? In the last you can say, okay Maria, I wish you a speedy recovery for you. Okay Maria, I wish a speedy recovery for your son. Like that. Okay, if it is a non-curable case, how we can do that? Because if it is a cancer, we cannot say that I wish you a speedy recovery for you. We cannot say that. Okay, so instead of that we can say I wish you a healthy life ahead. Clear? Okay, so these are the criteria you must follow during the role play card, and in the last you can say I hope I have cleared all your doubts and worries, and if you have any further queries you can contact us at any time. We will dare to help you 24/7. Okay Maria, thank you for listening me. You can wind up like that. Well, if it is in the hospital ward, how can you end up the role play? You can do it like this. Okay Maria, you can take rest now. Meanwhile, I'm going to the nurse's station. If you need any further help, you can press the buzzer over there. I'm there to help you. One important thing I'd like to tell you is please avoid using this you have to, you should. It is something like, you know, you are commanding to the patients, you know. If you're saying you have to take this medication, you should do this, it is something like we are forcing the patient, right? So we cannot force the patient to do something. We can ask the patient to do. For example, instead of using this had to and should, you can use you need to. You need to continue taking this medication. You need to follow this. We can say like that. So I hope you all got an idea how to use this criteria in your speaking role play card. If you use this, believe me, you will get a good score in your speaking role play card. Okay, that's this criteria. You need to follow the task. What are the tasks? It's there in your role play card. You need to follow this task with this criteria. Then for sure you will get a good score. Okay friends, for the time being I'm going to sign up. I need to go for duty. Well, take care. Bye bye. God bless you.